The other doctors, a total of 5, agreed to quietly board the yacht at several distant ports, all the way from the Battery out to the tip of Long Island. They got up, they climbed down surreptitiously, quietly. Nobody noticed them. Then they finally assembled aboard the yacht, and they disinfected the living room of the yacht. This was a small room, and at this time, Lysol had just been invented, and it proved to be carbolic acid, pretty good disinfectant. So they did disinfect the living room, and they performed the surgery there. Trouble is, there's no light, no directed light in this room. The only light is the skylight at the top of the room. The only electricity present was galvanic current, which was produced by one of the ship's stewards turning a voltage generator like this, which produced galvanic current. That was used for electrocautery, that is to stop the bleeding. But there's no directed light. The only light they have is coming from the skylight. Now, to make it worse, they strap him straight up in the chair, sitting in an upright kitchen chair, strapped. Surgical team consisted of an oral surgeon, 2 general surgeons, a dentist who provided the anesthetic, and the president's personal physician who kept monitoring the pulse. The risk, it seems to me, today was dreadful. The ship bobbing up and down on the East River and cruising at half speed, the surgical team went to work. 2 doctors used nitrous oxide, that's the dentist's laughing gas, in the patient, and they extracted 2 side teeth. I'll show you how this goes. They extract these 2 teeth behind the eye teeth with laughing gas. But then they knew that they're going to have to use ether for the rest of the surgery. One of the doctors, a guy named Keene, who wrote 25 years later, and he was the oral surgeon from Philadelphia, he wrote 25 years later in a piece in the Saturday Evening Post, 1917, he published it. He wrote about the operation for the first time, the first guy to ever divulge what happened. He said in this article, quote, "The anesthetic troubled us." Well, I'll bet it did. Speaking as one who has delivered a great number of general and sedation anesthetics in my career, I have come to know that even with modern technology, there is still a question of good risk, moderate risk, or poor risk. Grover Cleveland at this time fell under the last group. He was very corpulent, 100 pounds overweight, weighed about 160 pounds. He constantly cigar smoking, coughed all the time. He's 56 years old, has a short neck, and taking into consideration the fact that they have no suction in case the patient has a laryngospasm, how they stop it? They couldn't tip him backwards, he's strapped up in the chair. They have no oxygen with which to wake him up if they've overdosed. It seems to me a terrible risk. But they did give him the open drop ether, dropped on a sponge. He went to sleep satisfactorily. The surgeon excised a portion of his palate from right behind the eye tooth. I'll show you this. Imagine, here's the patient's left palate. The tumor is here on the palate. The incision goes from right behind the eye tooth here, across to the midline of the palate, all the way down through the palatal bone, cutting through the bone, back, taking the soft tissue, around to take the entire left sinus, and back down here again. So they're taking the entire left jaw out. What they have allowed to stay intact is the orbit, the orbital bone. They did find malignant tumor in the sinus, but the orbital bone, they said, we're going to take a chance and leave that, because they take the orbital bone, that's this bone right here. If they take that out, then of course the eye drops, and it's very evident that they've had serious surgery. So see, the procedure was done, and believe it or not, he woke up afterwards, and it was satisfactory. Immediately after the patient woke up, the next day, the dentist, who had, same one who delivered the open drop ether anesthetic, set to work making what is called an obturator. This is you can imagine a full upper plate. An upper plate that goes across the palate, as some patients wear, but they're not made with plastic. At that time, it was made by vulcanite, hard rubber. And in the undersurface of the plate, on the other side of this denture, is a knob which is just a little glob of hard rubber, which goes up into the void, the operative void, to fill the sinus and allow the patient to speak without sounding all the time like a cleft palate patient. That was done very successfully. The obturator worked, and believe it or not, within a few days, Grover Cleveland walked off the ship. Within another week, he had his vulcanite denture, which filled up the void in the palate. He delivered a magnificent speech to the joint session of Congress on the financial crisis on August the 7th, just over a month after his surgery. Amazingly, considering the primitive method of the surgery, this is the most important part of this. Amazingly, Grover Cleveland never had a recurrence of his sarcoma of the palatal bone. He lived on until 1908, finally dying of other causes. The other amazing thing is that, talk about people who can keep a secret. This is an amazing story. The newspaper writers never learned of it because these docs never talked. They did not even tell their spouses. They figured if their spouses knew, they would tell the hairdresser and it's all over. But they didn't. And there is no blabbermouth, as we might find today in London, for anybody who ever worked for the royal family for the last 25 years. There's none of that. It wasn't until 1917, Dr. Keene, the last surviving one of the surgeons, he was the oral surgeon in Philadelphia, he finally published it in the Saturday Evening Post. In the meantime, the lovely and only White House bride, Frances Folsom, lived long enough to be able to sit next to Dwight Eisenhower in 1956 at a banquet table, 70 years after she had been married in the White House. The financial crisis, the panic of '93, dissipated very quickly. Everybody apparently got their farms back. And no, I don't know whether these doctors had any malpractice insurance or not. But believe me, if they did it today, they sure would.